78-year-old Dorothy drank a relaxing sleep tea every night before bed, but she woke up 3 times before dawn, heart racing and sweating. For 6 months, she assumed it was just part of getting older. Then her doctor asked a simple question: "What tea do you drink?" Dorothy showed him the label: chamomile, valerian, green tea blend. The doctor immediately paused. This blend contains hidden caffeine, and valerian can cause paradoxical stimulation in some people. The very first night Dorothy stopped drinking it, she slept 6 hours straight without a single awakening. After 60, your body doesn't process tea the way it did in your youth. Caffeine half-life can double, meaning the tea you drink at dinner is still circulating in your system at midnight. Certain herbs can interact with your medications. Others silently raise your blood pressure or irritate your bladder. In this video, I'll explain, with scientific reasoning and clear examples, which 5 tea types destroy your sleep quality and put your health at risk. I'll show you exactly what to watch for on labels, where decaf, herbal, or calming can still hide stimulants. And I'll present 5 safe tea alternatives backed by research and long clinical experience that truly deliver deep, restorative sleep. But first, check your kitchen cabinet. If you have teas labeled sleep, calming, or relaxing, and you wake up tired every morning, don't touch them before watching this video. Before we explore the dangerous 5, let me explain why tea affects older bodies so differently. After 60, your liver enzymes slow down significantly. The cytochrome P450 system, responsible for metabolizing caffeine and many plant compounds, can operate at roughly 60 to 70% of its earlier capacity. That means caffeine a 30-year-old clears in 4 to 5 hours might remain in your system 8 to 10 hours, sometimes longer if you're a naturally slow metabolizer or take medications that compete for the same enzymes. Your kidneys also change with age, filtering fluids more slowly and altering how quickly your body eliminates compounds from herbal teas. Additionally, the blood-brain barrier becomes slightly more permeable with age, allowing substances that previously had minimal effect to exert a stronger influence on mood, alertness, and sleep architecture. Medication interactions present another critical concern. Many older adults take blood thinners, blood pressure medications, diabetes drugs, reflux medications, or antidepressants. Certain tea constituents can alter how these work, either reducing effectiveness or causing dangerous accumulation. Natural is not a synonym for risk-free, especially after 60, and especially at bedtime. Now let me walk you through the 5 worst tea types for people over 60. First, green tea, even decaffeinated versions, consumed in the evening. Even decaffeinated green tea retains roughly 2 to 5 milligrams of caffeine per cup. Some blends, especially matcha-based or strongly steeped varieties, can deliver more than you expect. Combined with L-theanine, an amino acid that promotes calm focus rather than sedation, this can create subtle stimulation your aging nervous system struggles to overcome at night. Studies and clinical observations show that green tea consumption within 4 hours of bedtime can reduce total sleep time and decrease sleep efficiency in older adults. Many seniors report falling asleep fine but waking frequently through the night. This fragmented sleep significantly impairs the deep, restorative stages you need for memory consolidation, immune health, and cellular repair. Green tea also interferes with non-heme iron absorption, which can worsen borderline anemia, and it may interact with blood-thinning medications. If you love green tea, enjoy it earlier in the day and avoid it entirely after mid-afternoon. On labels, remember that Camellia sinensis, matcha, sencha, gunpowder, and bancha are all forms of green tea. Second, herbal tea blends containing valerian root. While valerian has been used for centuries as a sleep aid, the research tells a complicated story. Approximately 20 to 30% of people experience paradoxical reactions: agitation, restlessness, racing thoughts, vivid dreams, even heart palpitations, rather than sedation. This percentage appears higher in older adults due to age-related changes in GABA receptor sensitivity and shifts in inhibitory-excitatory balance. Valerian can also potentiate sedative medications, increasing the risk of excessive sedation, dizziness, and nighttime falls. It may interact with blood thinners and certain antidepressants. With daily long-term use, some people develop a mild dependency pattern and report withdrawal symptoms, worsened insomnia, anxiety, night sweats, when stopping abruptly. There are case reports of liver enzyme elevations with concentrated valerian supplements. While tea is generally milder, nightly use still warrants caution. Take Harold, a 72-year-old who drank valerian tea nightly for 3 years. When he forgot it on vacation, he experienced severe insomnia, night sweats, and anxiety. His doctor recognized withdrawal-like symptoms. It took 2 weeks to normalize his sleep with a slow taper and non-valerian alternatives. Third, any tea containing licorice root, often found in adrenal support, stress relief, or digestive comfort blends. Licorice root contains glycyrrhizin, which affects aldosterone, the hormone regulating sodium and potassium balance. The result can be sodium retention and potassium loss, leading to fluid buildup, increased blood pressure, muscle weakness, palpitations, and dangerous electrolyte imbalances. For seniors whose kidneys handle sodium less efficiently and who may already take diuretics or blood pressure medications, licorice creates a perfect storm. Blood pressure can creep upward over weeks or months, puzzling both patient and clinician. Older adults on antihypertensives are particularly at risk because licorice can counteract medication effects. Margaret, 76, drank a digestive comfort tea nightly that contained licorice root. Over 3 months, her blood pressure climbed from 130/80 to 165/95. Her doctor increased medications twice. When a pharmacist noticed the licorice on the ingredient list and advised stopping, her pressure normalized within 2 weeks. If you see licorice, licorice root, or Glycyrrhiza glabra on a label, be very cautious. Deglycyrrhizinated licorice, DGL, reduces glycyrrhizin, but for evening use after 60, it's safer to avoid licorice entirely unless your own clinician approves. Fourth, yerba mate and tea blends containing guarana or other caffeinated botanicals. Yerba mate contains approximately 85 milligrams of caffeine per cup, similar to coffee. Guarana contains even more and is sometimes added to herbal energy or focus teas that look innocently plant-based but act like stimulants. With your extended caffeine half-life after 60, evening yerba mate could mean 40 or more milligrams still circulating at 2 in the morning, essentially a late espresso. The stimulation prevents the very deep sleep stages that repair tissues and stabilize memory. Beyond caffeine, yerba mate contains other xanthines that add to the stimulant load. Clinically, this can show up as anxiety, tremors, heightened heart rate, and severely disrupted sleep. Research and experience also raise concerns about bladder irritation and increased urinary frequency. For older adults already dealing with nocturia, mate-based blends virtually guarantee additional awakenings. Scan labels for yerba mate, Ilex paraguariensis, guarana, Polinia cupana, guayusa, cola nut, or even cocoa nibs, all of which can keep you wired at night. Fifth, kava kava, sometimes included in anxiety relief and sleep-promoting blends. While some research supports kava's anti-anxiety properties, serious safety concerns have emerged regarding liver health. Multiple countries have banned or severely restricted kava due to reports of severe liver toxicity, and health regulators have issued warnings about kava-associated liver damage, including rare cases of liver failure. Most severe events involved concentrated supplements or extracts, but daily tea consumption still raises concern, especially for older adults whose liver function naturally declines. Kava also interacts with numerous medications, potentiating sedatives, interfering with certain Parkinson's medications, and affecting drugs metabolized by liver enzymes. Some users report morning grogginess or cognitive sluggishness the day after use. If a sleep or calming blend lists kava or piper methysticum, it doesn't belong in your evening routine unless cleared by your clinician. Now let's shift to solutions. You don't need to give up an evening tea ritual. You just need a smarter cup. Here are 5 excellent options that can genuinely support better sleep without the risks above. First, pure chamomile tea. Chamomile contains apigenin, a flavonoid that binds to benzodiazepine receptors in the brain, producing mild sedative effects. Unlike valerian, chamomile's effects are gentle and predictable. Studies in older adults have shown meaningful improvements in subjective sleep quality, fewer nighttime awakenings, and less pre-sleep anxiety. It's generally well tolerated with few drug interactions. The main caution is for people allergic to plants in the daisy family. Steep chamomile for at least 5 minutes in water just below boiling, about 90 to 95 degrees Celsius, 195 to 203 degrees Fahrenheit, and drink 30 to 45 minutes before bed. Second, passion flower tea. Passion flower contains flavonoids and alkaloids that increase GABA through mechanisms different from valerian. Research suggests it produces calming effects without significant morning grogginess. Many people report improved sleep continuity, fewer awakenings and easier returns to sleep when using passion flower in the evening. Its advantage is working synergistically with your natural sleep drive rather than forcing sedation, which supports a more natural sleep architecture. It may interact with sedative medications, so consult your doctor if you already take sleep aids or anti-anxiety drugs. Steep for 5 to 7 minutes. Third, lemon balm tea. Lemon balm contains compounds that inhibit GABA breakdown, effectively increasing this calming neurotransmitter's availability. Studies have found that lemon balm can reduce anxiety and restlessness and improve sleep quality. Some research suggests it may support cognitive function in older adults, helping attention and memory on simple tasks. The flavor is mildly lemony and pleasant. It can be consumed regularly without evidence of tolerance or dependency. It's considered very safe, though it may interact with certain thyroid medications. Check with your clinician if you're on thyroid therapy. Fourth, lavender tea made from dried lavender flowers. Lavender's aroma alone has measurable effects on the nervous system, promoting relaxation and easing pre-sleep tension. When consumed as tea, its volatile oils may provide additional calming effects from the inside out. Research on lavender's sleep benefits is promising, especially when paired with other gentle herbs such as chamomile. The taste is distinctly floral. Start small, or combine half lavender with half chamomile to soften the flavor. Lavender is generally safe with very few reported interactions. Fifth, rooibos tea, also called red bush tea. Rooibos contains no caffeine naturally, not even trace amounts, which makes it an ideal nighttime-based tea. It's rich in antioxidants with a variety of potential health benefits. While not specifically sedative like chamomile, its complete lack of stimulants makes it excellent for evenings, particularly if you're sensitive to even small amounts of caffeine. Rooibos has a naturally sweet, slightly nutty flavor many people enjoy without sweeteners, and it can steep longer without becoming bitter. Now for practical implementation. First, transition gradually over 2 to 3 weeks if you've been drinking problematic teas for years. Your nervous system adapts to nightly patterns. A sudden change can create rebound insomnia. Replace one risky tea at a time with a safer alternative so your body can relearn the cues for sleep. Second, herbal teas don't work instantly. Give new teas at least a week of consistent use and pair them with a calming pre-sleep routine. Dim the lights, reduce noise, and slow your breathing. Third, drink sleep teas 30 to 45 minutes before bed, not as you lie down. That window lets the calming compounds act while also reducing the chance of a bathroom trip interrupting your first sleep cycle. Fourth, quality matters. Choose reputable brands, favor organic single herb options, and be skeptical of proprietary blends that don't disclose precise ingredient amounts. Fifth, if you take prescription medications, consult your doctor or pharmacist before adding new herbal teas. Bring the package to your appointment so the exact ingredients can be reviewed for interactions. Because labels can be confusing, here's what to watch for. Words like herbal or natural don't guarantee caffeine-free. If you see green tea, black tea, oolong, white tea, matcha, yerba mate, guarana, guayusa, cola nut, or cocoa nibs. Assume there's a stimulant effect and move that tea to the daytime. If a sleep blend lists valerian, kava, or licorice root, think twice. These are frequent culprits in poor sleep, blood pressure spikes, or morning fog in older adults. If a blend uses phrases like energy, focus, or metabolism, it almost certainly isn't bedtime friendly. And if an ingredient list is long and vague, proprietary blend, natural flavors, it's safer to skip it at night. Remember that tea is just one component of good sleep hygiene. Maintain consistent sleep and wake times, even on weekends. Keep your bedroom cool and dark. Limit screens and bright light for at least an hour before bed, and get morning sunlight to anchor your circadian rhythm. Address underlying conditions such as sleep apnea, chronic pain, reflux, or restless legs if they're present. No tea can compensate for untreated medical issues. Individual responses vary, so keep a simple sleep diary. Which tea you drank, when you drank it, how long it took to fall asleep, how many times you woke, and how you felt in the morning. Within a week, patterns emerge, and you'll know what helps and what hinders. If you found this valuable, share it with friends who might benefit. Many older adults struggle with sleep without realizing their evening tea could be part of the problem. Leave a comment telling us which tea surprised you most and which alternative you want to try first. Subscribe for more evidence-based health information tailored to older adults. Your perfect cup of evening tea is out there. You just need to know which one to choose. To recap your action plan for tonight, move any green tea, matcha, yerba mate, guarana, licorice, valerian, or kava blends out of your evening rotation. Replace them with chamomile, lemon balm, lavender, passion flower, or rooibos. Steep properly, sip 30 to 45 minutes before bed, and keep the rest of your pre-sleep routine calm and consistent. Track your response for 7 nights, then adjust. Everyone's nervous system is unique, and the goal is deep, uninterrupted restorative sleep. A final reminder, this program is educational and not a substitute for personal medical advice. If you have liver or kidney disease, heart rhythm issues, severe anxiety, or if you're pregnant or nursing, speak with your healthcare provider before adding or removing herbal products. If any tea makes you feel wired, dizzy, or unwell, stop it and reassess. Gentle, consistent changes are the safest path back to the kind of sleep that lets you wake clear-headed, steady on your feet, and ready for the day. Dorothy changed one small habit and reclaimed her nights. You can too. Start tonight with a wiser cup.